Hello there, and welcome to this discussion about the current vaccination distribution around the local area. I'm pleased to say that on the call we have the leaders of both Guildford Borough Council, that's Joss Bigmore, and also Waverley Borough Council, that's Councillor John Ward, as well as Philip Ridsdill Smith, who is in charge of the distribution of the COVID vaccination around this local area. And Phil, I think therefore, if it's okay, we'll start with you. That is quite a role. It's obviously a big, important job at the moment. How are things going locally?
I mean, it is a big role, but it's a role that we have a huge team of people and the community fully behind us and helping us with. So yes, that makes it a lot easier. It's going very well. We're delivering out vaccines in huge numbers to our residents out of two main sites, G Live in Guildford and Cranley Village Hall, but also housebound to those who are isolated to their house and to care homes as well. The latest figures that have come in have shown that we're actually have reached 90% of the over 80s are now vaccinated with their first vaccine, and the other cohorts are starting to follow those numbers right up. So it's going very well, and we're well on target to reach the government expectation that the first 4 cohorts will be vaccinated by that half-term break, which is great to see.
Now, Joss, I know that you and I, neither of us have been vaccinated yet. We'll come on to John in just a moment. But from your point of view, Joss, do you know where things stand at the moment with regards to you being vaccinated? And maybe Phil can help with that.
I think we're waiting our turn, aren't we? I think the government has set a strategy, but I think for those people that perhaps are on the, that are over 70 but haven't been notified yet, there may be a little bit of concern. So maybe Phil, if I were 70 and I hadn't been notified, what do I expect at the moment? Is there a phone number to call, or do I wait? What would I do in that situation?
So yeah, just to be clear, it started with the care homes, over 80s, and health and social care workers. So those are going to be the people who are ahead on the game at the moment. But since that time, it has included 3 further groups of people, which has taken us down to the over 70s now, which we've now been doing over the course of the last week, and the clinically extremely vulnerable. That is those people that were shielding and having to stay indoors because of the COVID pandemic for fear that they were going to become extremely unwell if they did get the infection. And essentially, the way in which people are being invited in is really twofold. The main way is that your GP practice will be in contact with you. That is, each of the GP practices are helping us out, and we are predominantly phoning people up, but we also have the ability to SMS text message, obviously not quite so relevant for the early cohorts of over 80s, because we want to make sure that we're being very inclusive to everybody, even those who don't feel so confident on that side of things. The second way in which you're getting invited in is with some of the national invite letters, which allow you to then phone up 119 or go onto the website and book in. But that will often take you to the mass COVID vaccination site up in Epsom. So it's going to be much more through your general local practice.
Now, John, I know you have been vaccinated. How was the experience for you, sir?
Absolutely first rate. I mean, both my wife and I have been done. I got a text from my local surgery, and my wife got an information through the NHS app. So I certainly would say to people, either have the NHS app on your phone or make sure your surgery has your mobile number, and that will increase the communications. I got notified 2 days later. I went down to Farnham Hospital, loads of volunteers around, very well organized. Everything we were told beforehand was really good. 6 people queuing, so, not a massive queue or anything, well handled. All the chairs we sat on clearly disinfected. All the paperwork was excellent and in order. A little card to say when we'd been vaccinated to take away. I got AstraZeneca. I think if you were 2 years older than me, you got the end of the Pfizer lot, but no reaction from me whatsoever. superbly organised, as I say, and, you know, really, if you get invited, rush down there.
Now, Joss, I know at Guildford Borough Council, you got some inquiries recently when it was said that the G Live Centre was shut. I know that came in to the council. I presume that therefore then went from you as a council to Phil.
Yes, I mean, I think that there's obviously the vaccination centres rely on supply of vaccines, so there was some concern amongst residents when G Live was seen to be temporarily closed. So obviously there was concern, but I think probably Phil's the one to talk about how they manage these kind of supply issues.
So yeah, let me talk you through that, because the vaccination is supplied to us on what's called a push model. That is, we are informed about 1 week in advance what we can expect to receive. So this is not something that we have huge control over, or indeed any control over. And when last week we were told that our vaccine delivery date had changed, it simply meant that we didn't have any vaccinations to give anybody. So it wasn't that anybody was cancelled out, it was just simply that there was nothing left in the fridge to give, and it was going to come in on a different day. And indeed, when we got to the end of the week, we delivered just the same number of vaccines as we had the previous week, just on different days of the week.
Just on that as well, Phil, in terms of spare vaccines at the end of the day, if you do have them, whether it be Pfizer, whether it be AstraZeneca, or indeed in the future others coming on stream, what's the model there? What happens?
So there's a lot of talk about spare vaccinations that are available at the end of the day, and the reality is there aren't many on that side of things. Indeed, our ambition is to have literally no vaccines left at the end of the day. Essentially, these are coming in as big batches, batches of 1,100 vaccines, and certainly in the early stages, when we didn't have the AstraZeneca as a sort of prop up, then if people didn't turn up, then we did need to fill those spaces. But what we always made sure was that we had people who were within a stone's throw of the area, were in the correct cohort, and were still requiring their first vaccine, and we would bring them down. What we found was actually that there were very few people who didn't attend their appointment. People have been, you know, really robustly making their way there, come snow or ice, to get their vaccine. And the numbers of people actually not turning up is very low indeed. But yes, we do have a way where we are fairly making sure that it goes to the right people if we have 1 or 2 left of the vaccine doses at the end of these multi-dose files that we use.
Well, gentlemen, I think we'll leave it there, but I think all of us on this call would agree that in terms of further information, people are encouraged very much to look at the official information, obviously government website, NHS website, obviously the Borough Council's website and social media as well. I think we probably would all agree with that.
Yes, very much so. There are some scams out there, and we don't want to see people trapped with these. This is a free vaccine. And it is something that, as I say, if you just follow the way of getting contacted by the GP practice or use the national booking system, you won't get caught out by that.
Thank you very much indeed.
NHS are doing a fantastic job.
Agree. It's reasons to be cheerful in 2021, gentlemen. Thank you very much indeed for your time.
Thank you.
Thank you.